Hi, I'm interested in learning more about cardiovascular disease. Can you tell me a little bit about it?
Sure, cardiovascular disease is a broad term that refers to any condition that affects the heart or blood vessels. This can include things like high blood pressure, coronary artery disease, heart failure, and more.
What are some common risk factors for developing cardiovascular disease?
There are several risk factors that can increase your chances of developing cardiovascular disease, including age, family history, high blood pressure, high cholesterol, smoking, obesity, and diabetes.
How can someone reduce their risk of developing cardiovascular disease?
There are several things you can do to reduce your risk of developing cardiovascular disease, including eating a healthy diet, getting regular exercise, maintaining a healthy weight, quitting smoking, managing stress, and getting regular checkups with your healthcare provider.
Are there any specific foods that are particularly good for cardiovascular health?
Yes, a diet that is rich in fruits, vegetables, whole grains, and lean proteins can be beneficial for cardiovascular health. Additionally, foods that are high in omega-3 fatty acids, such as fatty fish, can be particularly beneficial.
That's good to know. How much exercise should someone aim to get for cardiovascular health?
The American Heart Association recommends at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week for cardiovascular health.
What are some examples of moderate exercise?
Examples of moderate exercise include brisk walking, cycling, swimming, and dancing.
And what about examples of vigorous exercise?
Examples of vigorous exercise include running, high-intensity interval training, and playing sports like basketball or soccer.
How can someone manage stress to improve their cardiovascular health?
There are several ways to manage stress, including meditation, deep breathing exercises, yoga, and talking to a therapist.
That's helpful. Are there any medications or treatments available for cardiovascular disease?
Yes, there are several medications and treatments available for cardiovascular disease, including blood pressure medications, cholesterol-lowering medications, and procedures like angioplasty or bypass surgery.
Is it possible to live a normal life with cardiovascular disease?
Yes, with proper management and treatment, many people with cardiovascular disease are able to live normal, healthy lives.
That's good to know. How can someone find out if they have cardiovascular disease?
It's important to talk to your healthcare provider if you have any concerns about your cardiovascular health. They may recommend tests like blood pressure screenings, cholesterol screenings, or EKGs to evaluate your heart health.
Are there any warning signs or symptoms of cardiovascular disease?
Yes, common warning signs of cardiovascular disease include chest pain, shortness of breath, dizziness, nausea, and fatigue.
What should someone do if they experience any of these symptoms?
If you experience any of these symptoms, it's important to seek medical attention right away. These symptoms could indicate a serious heart condition that requires immediate treatment.
That's good to know. Can someone still develop cardiovascular disease even if they live a healthy lifestyle?
Unfortunately, there is no guaranteed way to prevent cardiovascular disease. Even if you live a healthy lifestyle, there may still be factors outside of your control that can increase your risk.
Moving on to the next topic, let's talk about the factors that contribute to cardiovascular disease.
Sure. There are several factors that contribute to cardiovascular disease, including high blood pressure, high cholesterol levels, smoking, obesity, and a sedentary lifestyle.
Exactly. And it's important to note that these factors can be controlled through lifestyle changes, such as a healthy diet and regular exercise.
Right. And if you already have some of these risk factors, it's even more important to take steps to manage them to prevent cardiovascular disease.
Let's discuss the symptoms of cardiovascular disease now. Some common symptoms include chest pain or discomfort, shortness of breath, nausea or vomiting, and lightheadedness or fainting.
Yes, and it's important to seek medical attention immediately if you experience any of these symptoms, as they could indicate a serious condition.
Moving on to the next topic, let's talk about the treatment options for cardiovascular disease.
There are several treatment options, including lifestyle changes, medications, and surgeries, depending on the severity of the disease.
That's right. Lifestyle changes such as a healthy diet and regular exercise can help manage mild cases of cardiovascular disease. Medications such as blood thinners or cholesterol-lowering drugs can also be prescribed.
And in more severe cases, surgery may be necessary, such as bypass surgery or stenting.
Let's wrap this up by discussing some ways to prevent cardiovascular disease. One important step is to quit smoking if you smoke.
Yes, and maintaining a healthy diet, exercising regularly, and managing stress are also important in preventing cardiovascular disease.
And it's important to get regular checkups with your doctor to monitor your risk factors and catch any issues early on.
Absolutely. Taking care of your heart health is crucial for a long and healthy life.
Well said. That's all the time we have for today. Thank you for joining us for this important discussion on cardiovascular disease.